I'm just thinking about a couple of examples of individuals. One goes back to the first time at it was College Hospital in Newark. I was, again, a medical student. And we were on rounds, and we went into an ICU. And back then, everyone really went on rounds, and they had these big discussions, and everyone was around the bed. And there was a comatose man, maybe in his 30s, 20s, late 20s, early 30s. He had a CAT scan. He had a lumbar puncture. He had blood work. That no one could figure out why this guy was in a coma. And the attending, in front of everybody, walks up to the bedside and says to the residents, "Did you do a drug screen?" "Yes." "Did you look for metabolic defects?" "Yes." Goes through this entire thing. This was like right in front of you. This is all happening. The attending then starts to do a physical. And he deliberately out loud says, as he's taking the hammer, "When you tap the knees for a comatose patient, the leg will always move." And he went through reflex after reflex. And every time he did that reflex with the hammer, the reflex occurred. Then he said, "This is the most important reflex that always occurs for comatose patients. When you tap on their shoulder, their arm goes out straight." He tapped on the shoulder and the arm went out straight. And that person, I don't think, was malingering. I can give you another example of this where I used that experience with a child. It was a second or third opinion. It was a child who had what I call the Willy Wonka grandpa syndrome, where you're in bed, grandpa can't get out of bed, he's passing out. And you know that the longer you remain bedridden, the harder it is to get out of bed. You get dizzy. So this child actually had neurocardiogenic syncope, meaning when the child would get up, the child would pass out. So they come to me. This has become a disaster in this family. And in the office, the first time I'm seeing them, I have this person, we're going to stand. We have her stand, and she passes out. So then I had her squat. Squatting alleviates or removes this neurocardiogenic syncope mechanism. It loads the blood back in. Passes out. So I said the same things that this doctor said. When they're passed out and comatose, she'd be like this, everybody be holding her. And I went through the reflexes, and I actually did the arm one, and the arm went out. It doesn't mean that that person didn't have an underlying problem. And most times they do. It's understanding where disease versus your intellect overlap. And I've seen this over and over again